The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Dallas-Fort Worth. Welcome to another Ask the Expert show, where we always, for the last 13 years, have brought you the finest experts in the field of health, legal, financial, and home improvement. We have got two fabulous shows for you today. Our first show, we're going to be talking about auto accident injuries. We have the Texas Functional Health Centers. And want to say good morning to our expert. Good morning, Adam.
Good morning. How are you?
We're doing good. Well, I got to tell you, I am so impressed with where chiropractic has come from. You guys, you do so many non-invasive, non-surgical healings of so many different areas of pain, Adam. I'm just blown away. I mean, we do a show like this all over the country, and anywhere from neuropathy to herniated disc. It's just amazing what you do now.
For sure.
So tell people about your practice.
We've been here in Dallas-Fort Worth. We're at the Baylor Complex. It's been 11 years now. We specialize in doing more of a combined approach, so physical therapy with chiropractic to get the patients the best ultimate outcome and an overall sense of health, as opposed to just moving a joint or just stimulating a muscle. We try and get the muscles to move the joint so that we can actually heal the patients. It's been a lot of fun taking care of patients and helping people get better.
What is functional medicine, Adam?
Functional medicine, if you wanted to go with a broad category, is going to be a type of medicine that's going to really support the systems of the body, get the body to support itself. So we're trying to figure out what's impeding normal functions within the body, whether it be the nervous system, the intestines, the autoimmune systems. We're trying to support it so that it can do its job the way that it's supposed to, as opposed to supplementing it with medications or something that would change the system. We're just trying to get the system to work the way that it's supposed to again.
You know, we're going to be talking about personal injury. Usually that's auto accidents and slip and falls. What are the most common types of personal injuries you see at your clinic?
I mean, overall, the most common we're going to see is something from a car accident, whether it be a minor car accident, so a slight whiplash, and think like a 5 mile an hour, somebody taps you in the bumper. There's definitely going to be some soft tissue damage from that. We do get some slip and falls, people that injure their shoulders, say in a gym or something like that. But those soft tissue injuries are what we're going to see the most within a car accident. We do support people that have had either traumatic brain injuries within those car accidents and other things, neurological conditions, to get them to the right care at the same time that we're taking care of all the other injuries that they've had.
So there are so many automobile accidents out there, and there's people who have been injured for the first time. But aren't there times where you're in an accident and you're not feeling any pain? And so you say, well, I don't have to see a doctor. But then something happens with 2 or 3 days. Do you see that a lot?
For sure. Yeah. The human body is amazingly resilient. So, and if you think about the nature of us, if we were chasing a gazelle on the savannas and we fell down, we have to get back up, we have to keep going. And so our systems are developed to accommodate minor injuries and keep going very well. The inflammation process doesn't reach its peak until 72 hours after a particular injury. So a young, healthy person being in a car accident, usually I'm not going to feel a tremendous amount unless it was very serious. Maybe some soreness or tightness until 2, maybe 3 days later when everything starts to stiffen up. And that's a process of that inflammation, everything's swelling up. It puts a lot of pressure on the joints, the soft tissue around it, and starts to restrict our normal range of motion. The big problem with ignoring that is that that's going to lead to problems down the road. Right? Your body may accommodate for it. It may feel better within 6 to 7 days, but that damage has been done. And if you don't do something to facilitate the healing of that damage, it's just going to continue to get worse at a very slow pace.
Adam, you're one of the top chiropractors in the Dallas-Fort Worth area. Can you tell if it's a new injury versus an old injury?
For sure. There's a number of different methods that we would use to determine whether something's an old injury or a new injury. The presence of what's called osteoarthritis or degenerative changes is definitely an indicator that something's more than 6 months old. So we may see like a bone spur or a disc that's gotten closer together, or two bones that have a pretty significant misalignment that's affected other parts of the body. That's not something that's going to happen within a couple of weeks. It's something that's going to happen with months and years. So there's many methods that we use to determine whether an injury is old or brand new. And sometimes those old injuries become a new injury in a new accident.
You know, what I got to tell you, what I love about what you do is many times you go to the doctor and they want to operate. They go to you and you've got so many ways of that are non-surgical way to treat somebody.
For sure. And that's really where our realm is between an injury and all the way to the point that you need surgery. And even if you do need surgery, the support process of getting everything to work the way that it's supposed to is going to have a better recovery for that person that has surgery. They're going to have better results and less chances of another surgery down the road.
You know, I don't want to try to scare anybody. This show is made to educate people. But, you know, some people, especially after an auto accident, they just blow it off, think everything's okay. But there's long-term risk for not seeking treatment, aren't there?
For sure. So there's a study out of Harvard that says car accident or a rear end accident where you're the driver in the car that's hit, 7.8 miles an hour is all it takes to cause permanent damage to an average human. So it's an average healthy person. Those ligaments and muscles that are injured will affect the range of motion of that particular joint. If you have a restriction in range of motion for any period of time, it's going to start that degeneration or osteoarthritis process. So you may not notice the significance of it for 5 or 10 years. And I get so many patients that come in, all of a sudden I have a lot of neck pain. My first question is going to be, have you ever been in a car accident? And they always say, oh, 5, 10, 15, 20 years ago, I had a small car accident, didn't think anything of it. And now they have pretty significant osteoarthritis and their neck's really in bad shape. So it's super important that even if it's a minor injury, to figure out if there is a problem, if there is some damage to a ligament or a muscle, and get it taken care of immediately.
You know, I got to tell you, I kind of show my age. It used to be a stigma about chiropractors. And now anybody who has used a chiropractor, there's no more stigma at all. It's the things that you do. I mean, I totally believe in a chiropractor because I went to a doctor for a slip and fall, and I got no relief at all. And someone said, "Why don't you try a chiropractor?" And I'm going, well, the doctor can't find it. How's a chiropractor? I got to tell you, I got so much relief from the chiropractor, and you guys go through so much training and education. It is amazing.
For sure. And most of our initial education's on par with a medical doctor. Our specialty is obviously in the joints, the muscles, and ligaments, which, if you think about the medical field, they maybe 10% of their time is going to be spent on spinal health, unless they're a neurosurgeon. But then the neurosurgeon's not going to do anything that we do. And so we
Right.
really fill a very particular place in the world that nobody else fills. So we're, our expertise in the joints, function, nerves, the muscles, the ligaments, and everything of the spine is unparalleled by any other profession.
Well, I got to tell you, you can tell that I'm just a huge fan. In fact, our next show is a chiropractor out of the Austin area on our Austin show. But what are some of the signs, Adam, that someone might need a chiropractor care after an auto accident or even a slip and fall?
Sure. Really, at any point in time, if you're feeling any decrease in normal range of motion, if anything's persistent more than 2 days, whether it be a tightness, a stiffness, a pinching feeling, most definitely if you have any numbness or tingling anywhere, that's a clear indication that you need to see a chiropractor or somebody that specializes in post-accident traumas. But anything that's out of the ordinary for any period of time, be it 2 or 3 days, definitely indicates that we have a problem that we need to get addressed or at least checked out to make sure it's not going to continue to be a problem.
I have to tell you a story because it's a recent story. My girlfriend did and this happens. I know it's sometimes it's the way you lay at night in your bed and you wake up the next morning and you can't even move your neck and you are in so much pain. And I said, you got to go to a chiropractor. And she said, no. And I finally convinced, now we're here in Florida, you're in Dallas, but she went through so much pain for 4 or 5 days. I finally convinced her to see a chiropractor. And you should have seen her face after, I guess, is it still called an adjustment? But
Sure.
You should have seen her face, Adam, that the mobility she had just after one treatment. And of course, she's going to need follow-up, but it was just like she was like shocked. And she should have been, because this is what you do.
For sure. It's amazing when you have those acute instances, how much difference you can make with the adjustment. How much pressure it takes off the nerves. It's really, really quite miraculous most of the time.
I know. I mean, if I were you, I'd be pinching myself every morning because I got it. Pain, it is sometimes it can get so unbearable. When again, showing my age, it used to be, you would, if you were going to look for a chiropractor, you'd go to the yellow pages. And it was funny. People would choose the chiropractor based on how large an ad they had. That's how crazy it was. Well, those yellow page ads are no longer. So one of the purposes of this show is when you need a chiropractor, that you don't have to go and see who's got the nicest website. What we do is we bring you the creme de la creme, and that's what we do with Texas Functional Health Centers. What are some of the roles of a chiropractor care? Like, how can a chiropractor help mostly with personal injury, mostly the recovery?
Sure. Within the recovery, it's important that we maintain normal function of the body. The point and purpose of that is that, let's go back to the most common thing that we're going to see injured in a car accident is going to be a ligament. A ligament's a piece of connective tissue that holds two bones together. You can think of it like an elastic band in your underwear, right? If you pull it too hard, you're going to tear some of the fibers in it, and it's not going to recover or have the same distance that it had before. If you leave that alone, that scar tissue that forms around it is going to restrict that normal range of motion so much so that you can't move that joint anymore. Our purpose is to help that recovery of that particular soft tissue or the ligament so that it can have somewhat of that normal range of motion, as close to normal range of motion as possible, so that we can keep us from developing the degeneration process that would follow. We support the muscles, the ligaments, the discs, and the joint spaces. So it's really a whole aspect of making everything function the way it's supposed to as it recovers so we can get the best possible outcomes.
Boy, I tell you what, our chat line is on fire right now. Uh, Someone just wrote, what causes osteoarthritis?
Sure. Osteoarthritis is much different than most of the arthritis you would think of. So if somebody said something about rheumatoid arthritis, we would think of an autoimmune induced where your body's attacking itself. And osteoarthritis is a lot different. It's really a wear and tear type disease. It's because something's not working correctly. You can think of it like the alignment in your car, right? So if something's out of alignment, it's going to start to wear out parts. And so the very similar thing happens with any joint in the spine, any joint in the body. It can happen to your TMJ, your toe, anything like that. And so really, once you get something out of alignment, it tends to stay that way unless something changes it, right? And that's my job, is to change it, to realign everything, get it to work the way that it's supposed to, get all the components working together in unison so that it can function the way it's supposed to, and prevent that osteoarthritis. The most common thing that we're going to see is osteoarthritis of the C5, C6, so the mid portion of the neck. It comes from a minor car accident that happened 5, 10, 15 years ago. And people didn't think it was a problem because we have so much recovery and function within the body that it's very, very hard to notice the difference. And it's such a slow process that most people don't know until it's already gone so far that it's very difficult for us to fix it.
Here's another question. Can a chiropractor help with the pillar tendon? I've never heard of that.
A pilar tendon? Tendon injuries for sure we can help with. Most of the time when we think of a tendon injury within a trauma, it's going to tear some of the fibers. Same thing like a ligament. Once you tear some of the fibers, your body's going to have an inflammation process that causes a lot of discomfort. Fortunately, the inflammation process is necessary. And so really we need to facilitate that recovery, but we want to facilitate the healing of the fibers in a normal orientation. The problem with not facilitating that healing is that the fibers will come back in a very irregular pattern and restrict that normal range of motion. And it tends to cause a higher incidence or higher rate of re-injury of that particular part unless you get the fibers to realign correctly so that you can re-strengthen that particular tissue.
We just got a text in from Maria in Carrollton. She wants to know, my doctor told me on my knees, I'm bone on bone. Can you do anything about it, or do I have to have surgery right away?
Really, it depends on the degree of damage to the bone itself. There's a lot of variables. I've helped many people that have had bone-on-bone injuries. A lot of times once the doctor says it's too far, or like an orthopedic surgeon says it's too far, it still has a great chance of recovery to a degree, right? My philosophy, especially once it's got bone to bone, if we can make it manageable and work where you're not in much discomfort and function, we could get you another 5, maybe 10 years from that knee surgery, which prolongs the function of the knee. Also, if you do end up having to have the surgery, it makes it where the recovery is easier. It makes it where you don't tend to have another surgery to replace that knee in a short amount of time. So you get longer durations between the surgeries because a knee replacement only lasts so long. The technology has gotten a lot more advanced. So say 20 years ago, a knee replacement would last you 7 to 10 years. Now they're 10 to 20 years. If you have the right function of the knee, regardless, well, all the things attached to the knee, so we think the muscles and everything else, it's going to prolong that even more. So maybe you can make it the rest of your life without having to have that replaced.
Wow, we're getting so many texts. I got this one I got to read. I am really enjoying your show. Thank you. We had written you to have a chiropractor in the Dallas-Fort Worth area. Thank you. We've just moved here. Does your doctor work in sports injuries?
For sure. I have a lot of background in soft tissue injuries and sports injuries. A lot of techniques that'll help a tremendous amount and recover the normal function of those particular joints and re-strengthen all the structures so that we don't have that injury again. We try and get you back to that sport as quick as possible.
This text, they must be listening on radio because on TV we're running your phone number. Can you please tell us where you're located and your phone number?
Our physical address is 411 North Washington. We're in the Baylor complex, the big Bumsey Baylor complex, and one of the buildings next to it. Our website is texasfhc.com, and our phone number is 469-334-0624.
We've got about a minute left. God, the show has gone by so fast. Adam, tell people why if they think they have an injury, any type of injury, that they should contact your office.
Anytime you have any kind of injury, it's super important that you address any of the dysfunction that's around it. The chances of you recovering with no issue in the future are very slim. Our bodies are facilitated for accommodation, which means that our body is going to make it work in the moment, but it's a really poor long-term solution. So it's really important that anytime anything's injured, that you get it addressed so that it doesn't re-injure, but also to prevent us from having any of the future problems with it. Any soft tissue injury is never going to recover very well on its own. So it really needs a lot of support, a lot of management in order to make sure that we have the best possible outcome.
Adam, I got to tell you, we are so lucky to have you. Let's give everybody your phone number one more time.
469-334-0624.
And Adam will be back again with us next month. Adam, thank you so much.
For sure. Thanks for having me, Steve.
Good to see you.
Good to see you.
We're going to go to break. We're going to be going to our Austin show. It's a separate show that we do, and I'm really excited. We're going to be talking about back pain. And even if you're not in the Austin area, please join us. We'll be right back.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
Hey, good morning, Austin. Welcome to another Ask the Expert show. I am telling you, you're going to love this morning's show. How many times have you had back pain? And I know about back pain because it can cripple you. It can cause you not even be able to take a breath. And everybody asked us about, would you bring a show on in the Austin area about back pain? And, it's not easy to find a great doctor. But we found a doctor, Dr. Stephen Klayman, that you're going to learn so much today when it comes to back pain. Good morning, Dr. Klayman.
Good morning, Steve. How are you doing?
Hey, see, we're fine.
All right. Good to see you.
Good morning to you. Dr. Klayman, tell people about your practice.
Yeah, I'm in Austin, actually in between Dripping Springs and Oak Hill. And I've been in practice for over 40 years.
That's it?
This is not your typical chiropractic practice, simply because we do a lot of musculoskeletal conditions, as most chiropractors do, but we also do some other things, what we call more organic conditions, things like asthma, acid reflux, irritable bowel syndrome, allergies, respiratory disorders, vertigo, things like that. And we use a technique that came out of muscle testing to diagnose and to treat. So the thing in my office is I also use muscle testing to figure out back pain. And today I think we're going to talk about specifically low back pain and how to determine if that is a condition that's going to respond to spinal manipulation, or is it a condition that's needed to go to surgery? And some of them go to surgery, and unfortunately, many of the ones that go to surgery do not come out any better because the surgery was done for the wrong reason. So maybe we can just get into the details a little bit, get into the weeds. How do you know if your back pain is something that's treatable conservatively or if it's going to end up in a surgeon's office?
Dr. Clayman, that's what I love about your practice. I mean, especially when it comes to the back, is, it doesn't always have to be treated by surgery. And
no,
what's so
actually,
amazing,
Steve, I'm going to tell you something. If you understand the anatomy, sometimes it's really quite simple. And actually, I teach a class called Fix Your Own Ass and Other Things Too. Because once you figure it out, sometimes the patient can do most of the treatment themselves at home, because I invented a device that people can purchase that will balance the hips. And when people go to the chiropractor, they know the chiropractor is always checking the leg length, because the leg length tells us about the position of your hips and whether it's misaligned or not. So unfortunately, if it's not a surgical case and it is a chiropractic case, unfortunately, sometimes you got to go 3 times a week for weeks or months till you get those hips to stay in place. Can we look at a little bit of the anatomy so we can understand what we're talking about? Let's do that, huh?
yes, that'd be great.
So this is a spine. This is spine 101. You have 2 hip bones and you have a sacrum in the middle. Let's turn it around and look at it from the back. So you see the sacrum in the middle and 2 hip bones attaching on either side, forming a sacroiliac joint. This joint over here is held together strictly by ligaments. That means that muscles and tendons do not really control this sacroiliac joint. It's held together by ligaments. So let's turn it around to the front again. Let's say one of these hips got misaligned. Let's say this happened.
Wow.
Now the femur head fits right in that hole. So if the hip goes like this and the femur head goes north, well, the whole leg is going north.
Right.
Means the foot is going to show up short on that side. The leg length on that side is going to be short because the hip went up and everything's attached, so it's got to go up with it. So what happens is when that joint misaligns, the ligaments here go in an X fashion, like this and like this. So some of the ligaments get relaxed and some of the ligaments get stretched. The ones that get stretched hurt. They get inflamed because they're being pulled. And it may take weeks or even months for those stretched ligaments to show up with inflammation. So what the chiropractor wants to do is he wants to take that hip joint and put it back in the right position so those ligaments back there can get relaxed again. And if he can do that, the inflammation is going to go down and you won't have a pain in your ass anymore. So because it's frequently been out of place for a long time and oftentimes doesn't hold, you got to come back 3 times a week, sometimes for months.
I'm on the air right now.
So about 14 years ago, I invented a device called a hip balancer. In my clinic, if the person's hip won't stay in position after 2, 3, 4 times, I have them buy this device, which looks like this. And when they lay on it, it balances out the hips immediately. As a matter of fact, this is the way I adjust the hips in my office using the hip balancer. I don't have to put the person in a position and thrust on them. If I lay them on these blocks properly, the short leg will even out and the ligaments will return to their normal position. So you just put a little ice on it at home and you're good to go. So if it
What
doesn't
causes
hold,
that, though? What
if it doesn't
causes
hold
that, Dr. Klayman?
I'm sorry,
What causes that?
that hip misalignment.
Yes.
Yeah, it could be caused from anything. It could be caused from having a big wallet in your back pocket. It could
Really?
be caused,
That's it?
yeah, sure. Sure. It could be caused by a fall or jumping off the trampoline wrong or a skiing accident or just walking off the curb wrong. And so if there's nobody to notice it and put it back in place, eventually it gets inflamed. So with the hip balancer, we can send the patient home with it. They do it 2 or 3 times a day. And in a week or 2 weeks of doing that at home, the hips stay in place, the inflammation goes down. That's the end of the story. So it's a really great way to fix
That is
non-surgical low back
amazing.
pain.
It's so much better than surgery.
Yeah, it's a little better than surgery.
How can you tell if back pain is from the spine or if it's from like an organ like the kidney?
That's a great question. So one of the questions we ask in the office when somebody comes in with back pain is, does moving change the pain? Does it make it better or does it make it worse? If movement changes your pain, almost 100%, it's a musculoskeletal condition. It's not an organic condition. It's not bone cancer. It's not kidney disease. So when we ask you that question, we want to know, does movement or motion change the pain? And for most people, that is the case. So we know that it's a musculoskeletal condition. Then we have to figure out, is it due to the hips being misaligned? Is it due to the vertebrae being misaligned? Or is it due to the facets jamming up into the nerve root? So if you look at the spine, on the top of the sacrum, this is the sacrum, remember. See these 2 prongs?
Yes.
Those are called facets. You have 2 prongs here on the top of the sacrum, and on the 5th lumbar, you have 2 prongs pointing down and 2 prongs pointing up. And you have a pair of each of these going all the way up the spine. The spine, the vertebrae in the spine are held apart by discs. See these discs here, Steve?
Yes.
Those keep the vertebrae apart. If, as you get older, the water starts to come out of those discs and the discs flatten out, then the facets can get closer to the nerve root and irritate the nerve root and cause back pain and or sciatic pain, where the pain's actually going down your leg. Now, the question is sciatic pain and back pain, is it due to a facet syndrome or is it due to a bulging disc? And again, there's some simple questions that we ask to determine if your back pain is due to a bulge of the disc or is it due to the facets jamming up into the nerve root. And those questions are, does it hurt when you cough, sneeze, laugh, or strain to go to the bathroom? If it doesn't hurt on those motions, and yet you're having back pain and sciatic pain, then we know it's probably not a disc. So a very important thing for people to note is, if we took an MRI on 100 people walking in the street today who did not have back pain, if we took an MRI on all of them, about a third would show bulging discs. Yet they don't have any back pain and they don't have any sciatic pain. They don't even know they have a bulging disc.
Wow.
So what that means is bulging discs don't always cause back pain. So the question we're going to ask you, does it hurt on coughing, sneezing, straining at the stool and laughing? If it doesn't, we're pretty sure that even if you have a positive MRI, it is not causing the back pain and surgery is completely unnecessary. So the next question we ask is, do you prefer to sit or stand? If you much prefer to stand, we know that sitting will jam these facets up into the nerve root. So it's another giveaway if you don't like to sit or if sitting irritates your back pain. The other question we'll ask, does it feel better when you go into the fetal position, like when you lay down? because going into the fetal position or just sitting and bringing your knees up to your chest is going to do this to the sacrum. It's going to pull it down, and it's going to pull those facets out of the nerve root, and you'll get relief. But you can't stay with your knees up to your chest all day long.
Right.
So you have to find a chiropractor who's willing to traction this sacrum down and pull those facets out of the nerve root, and frequently find that that gives sometimes instant relief.
Dr. Clinton,
The facets are important to know that they exist, because most people have never even heard of facet syndrome.
I know.
Have you?
I have low back pain, and I know mine's sciatica. But we just had a text. Somebody wanted to. First of all, they're thanking you for the show, but they want to know why, when my back goes out, do I have trouble breathing?
Well, when the back goes out, it creates so much pain that you don't want to move. And when you're breathing, you're actually moving the rib cage. And that could cause also some difficulty and some pain. But the problem, more than likely, is not coming from there if it's low back pain. If it's coming from the chest area when you breathe, then that's an indication that there's a rib out of alignment. So it depends on the area that you get the back pain. Back pain in the low back has nothing to do with up here in the chest and the ribs, but mid-back pain on breathing indicates that a rib is out of place and needs to be adjusted into position.
Well, the chat line is cooking. Someone just wrote, would you have to do an office visit to know your invention will help?
No, you don't. Actually, you just need to be able to do a leg check. You need to have your husband or wife lay you face down on the bed with your hands like this so you don't turn your head. And then he checks or she checks the length of the legs. And if you see that while you're on your stomach, one of the legs is shorter than the other, you know the hips are misaligned. Unless you fractured that leg and it healed shorter. That's the only other time. Barring that, if the leg length is different, your hips are misaligned.
I want to try to get in about allergies, because you treat allergies also.
And a third of my practice is allergies.
Someone wanted to know, where can someone find your class?
I have, you know what? You should call into the office, because we haven't announced when we're doing it next. But when we do it, the reason we call it Fix Your Own Ass is because the pain that you get in the sacroiliac joint is your pain in the ass.
Yes.
Spouse.
Yes.
And so you can fix that yourself. And there's a few other techniques that we teach that you can fix also. But getting back to the allergy situation, here in Austin, we have had a lot of allergies, and we're going to be coming into cedar fever season. And I studied with a man by the name of Dr. Victor Frank, who taught us lots of things that we could do for a lot of different conditions. And one of them was allergies. And it worked so well when I first started doing it, which was about 30 years ago. It worked so well that I developed quite a large allergy practice, because people didn't want to go take shots every week. So what we found is the allergies are caused by a hyperactive immune system. The immune system overreacts. It thinks that dust or that cedar or that dog hair is a virus or a bacteria. And it's not. It's just harmless. It's just dog hair. Now, most people don't react to dog hair, but some people's immune systems think that dog hair is a virus or a bacteria. So their nose gets congested, they start sneezing and coughing, and have all the allergy symptoms. Well, Dr. Frank taught us how to tap on the universal allergy adjustment points, which are points along the spine, along what's called the bladder meridian, the acupuncture meridian called the bladder meridian. And if you tap along those points while the allergen is in contact with the person's body, the body learns not to respond to it. And so it doesn't. So usually we find when somebody comes in here with allergies, either food allergies or airborne allergies, I have several vials in my kit with some with food, some with airborne stuff in them. When we place it on the body and we do a muscle test, if the body reacts poorly to that, we know they have an allergy to that substance. Then while that substance is on their body, we just tap on these points, and then usually while they're on the table, the sinuses start to clear. And now sometimes we have to do it 2, 3, 4, 5 times till it holds. But sometimes we do it once, and sometimes it'll hold for weeks, sometimes for months, sometimes for years. It's a fantastic technique, and I've gotten known in this area for being an expert in that technique.
Okay. Now, someone wanted to, I tell you what, we are getting so many questions on our chat line because we had some problems with your first show. So this is almost like your first show again. What can you teach about fixing ED?
That's not in my repertoire.
Okay.
Yeah.
What is your class cover?
It covers back pain, sciatic pain, asthma, knee pain, headaches. Headaches are really quite easy. And a few other topics. Yeah, those things, between headaches and back pain, almost everybody has that at some time or another. And both of those are actually pretty easy to treat. If you have headaches, I guarantee you'll find trigger points along the base of your skull. So we teach.
Yeah, is that same for migraine headaches?
No, migraines are a vascular problem frequently, but sometimes people's tension headaches are so bad they think it's a migraine. So we teach them how to do the 8 consecutive acupuncture points on their hand and on their head to take away a headache. And when we teach that and you do that in the order we describe, usually the headache will go away within a minute or two. Then the rest of the treatment involves pressing on the trigger points at the base of the skull. Because when those trigger points fire, they pull on the skull changes shape slightly. It causes the fibers that hang down inside the skull in the cranium to fire off, and that's called a tension headache.
If I take a drugless treatment like TBM, do I have to do it for the rest of my life, or is it every week like some shots are?
No. Like with my allergy patients, I tell them, and once we fix them, I say, come back if one of the allergens that we fix blows out. Otherwise, see you later. Same thing with like acid reflux. We teach how to fix acid reflux in the class, Fix Your Own Ass, because it's really quite easy. And so many people have been on drugs for years. So once it's fixed, sometimes it'll hold for a long, long time, like years.
We talk about pain on here. I know about acid reflux, and that is very painful when it attacks you.
Yeah, and the problem with that, the reason they give you the Nexium and the Prevacid is because they don't want you to burn a hole in your esophagus as the acid comes up, which is, that's important because that can lead to esophageal cancer. But when you're taking those drugs, it means you're decreasing the stomach acid and you're not digesting your food quite so well. And so you're more susceptible to bacterial and viral infections because one of the things that the stomach acid does is it kills bacteria and virus. So you don't want to really decrease it.
We just got a text. I am loving the show. I missed the first 5 minutes of it. Can you go over again the different areas you treat?
Well, we treat the whole body. I mean, we started off talking about low back pain as a musculoskeletal condition, and the difference and why surgery frequently is done for the wrong reason, meaning that the surgeon saw a positive MRI and he saw low back pain. He saw a disc bulge on the MRI and he saw low back and sciatic pain. And right away he put it together. That means surgery. Well, as we discussed, that doesn't always mean surgery, because many times the bulging disc that he finds on the MRI is not the cause of the pain. So those simple questions, does it hurt when you cough, sneeze, laugh, strain at the stool? Those questions tell us if there's a disc involved or not. If it doesn't hurt on those motions, it's probably not a disc, and it's probably another cause, like the facets jamming or the hips being misaligned. So
is your class, someone wants to know if your class is online?
It isn't.
Or is it person?
It isn't. But I tell you what, if you want to get on for the next class, call into the office and ask Kim to put your name down, and we'll notify you when our next class is happening. It'll probably be the beginning of the year.
Beautiful. Dr. Clint, I'm just amazed at I know you treat the whole body, but I'm just amazed at things that you treat, that chiropractic has come so far.
Absolutely. And when you add in the muscle testing component, also known as kinesiology, then it just expands it to all sorts of different conditions that you could cheaply and quickly get information about, instead of having to do expensive tests. Like usually you go to an allergy exam and the skin pricks, and you got to spend like $1,000 or $1,200 for that. It's a lot of money.
Yes.
You can figure it out in 10 minutes in an office visit and start treating it. It's fantastic. I've treated thousands of people. You know, we're going to get really busy in a couple of weeks because Cedar's coming in. We get to stay here in Boston for Cedar fever. And people move away from this area because it's so severe. They're walking around for 2 or 3 months like the flu. And usually we can knock it out in 1 or 2 visits. So it's quite spectacular.
Do you treat children also? Someone just wrote.
Yeah, oh, absolutely. We treat babies and kids.
Because I know children get a lot of allergies.
Yeah, unfortunately, this has become a chronic condition for kids. When you and I were kids, hardly anybody had allergies.
Yes.
Things are different now.
Let's tell people how they can reach you again.
Yeah, my office is in between Dripping Springs and Oak Hill. And the number is 512-301-7746. Or you can go online and look up Clayman Holistic Chiropractic Clinic. And we call it holistic because it's not just musculoskeletal conditions.
Dr. Clayman, we are so lucky to have you. You're going to be back again with us next month. We still have texts coming in, and I promise you we'll hold these texts and get to you those questions. Most of them are, how come the show is so short? We can't help that. Anyhow, we'll see you again next month, Dr. Clayman. Thank you so much. You did such a great job.
Thank you, Stephen. If you're ever up in here in Austin, we'll fix your ass too.
Hey, I went to school there. That's my college.
Oh, really?
I'm not so happy this week after the last game.
No, Georgia put it to us.
Yes. Thanks so much, Dr. Clayman.
All right, Steve. Thank you.
And that's Dr. Clayman. Boy, he is amazing. Thanks for all your questions. That'll do it for us today. We'll see you again next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.